Hi, my name is Debbie Hall and I'm the charge nurse of the Family Birthing Centre at the Hawkesbury General Hospital. I've been with Hawkesbury General for 33 years. I think it's really important that our patients in our community have access to care close to home so that amongst the family dynamics, it keeps the stress level down. It makes life a little bit easier in a time when life is very, very stressful. When we're traveling outside our community to access care, it puts more at risk through time management of the family, time management of the healthcare worker. So having everything in our community makes life a lot easier for the family, especially in the Family Birthing Centre, and keeps them happy. Often happier patients are healthier patients, and keeps our healthcare facility busy, providing jobs to our community as well. So it's a sustainability factor at the same time. I've worked most of my career in a couple of the phases of Hawkesbury General Hospital in obstetrics. We've been here for the last 4 months, 3.5 months, and it is certainly a pleasure to work in such an environment. It's a lot bigger than we had, so that actually adds to the safety of our patients. We don't have to trip over equipment, we don't have to trip over lighting systems. We have all of that installed. It seems to make for a quieter environment. Certainly a pleasure. It's very calming, the colors are calming, and I think the staff is adapting quite well to their new environment. So this is a Panda warmer, and it is an infant warmer. So how we utilize it is typically when a baby is born, baby does receive its heat from mom, skin to skin. But in those cases when baby is not doing well right after birth, this is a machine that helps us maintain the baby's heat, provides oxygen to the baby, helps monitor the baby in order for us to maintain the baby's health immediately after birth. I want to thank all of our donors to Hawkesbury General Hospital. Without their donations, we would not be able to purchase machines such as this to provide the best quality care to our babies and to our families in order to maintain their health and their welfare when they are born into our new community. So I'd like to introduce you to the triage room. This is a room that we didn't have in our old facility. What this allows our patients is to come in and be assessed without being admitted into a labor room. There's a saying, long-time saying in the obstetrical world, that the worst place for a non-laboring mother is in a laboring room. So what this does is it allows us to assess the mom, determine if she's in labor or in early stages of labor, and then make decisions in regards to her care from that point on. We have the fetal monitor, and we also have a stretcher that actually turns into a delivery bed should it be an imminent delivery with baby being born very, very quickly. We can actually do a delivery in this room. I'd really like to introduce you to our early labor room. This is a room that we also didn't have in our old department. What this room typically does, and it is utilized for, is the lady that comes in labor is just in the early stages of her labor, and as I had previously said, the worst place for a lady in early stages of labor or not in labor is in a labor room. So this is a room that mom that lives 45 minutes away, an hour away, maybe there's a snowstorm, the weather is not really conducive to driving. This is the room that she would come into and wait with her partner. And she would let us know if there's been any changes in her labor, if it's stopped, if it's continued. If it's continued on, we would take her back to our triage room and we would reassess her. If by some chance the labor stops, then she can go home and be discharged home from here. I want to thank everybody for joining me on the tour of our new Family Birthing Centre of Hawkesbury General Hospital. I especially want to thank everybody for donating who have made this new redevelopment project possible. I have to go now to see a lady who's about to deliver, but for those of you interested in donating, please call 1-844-888-3444. See you later. Thanks. Bye now.